ASL interpreters were available. We do have interpretation on video as well as fully captioned will be available by tomorrow. Today I'm going to provide a COVID-19 update. Then Chief Martinez will provide some additional public health guidance, and after that Chief Martinez will be available for any questions on COVID. The state numbers as of Monday, 3,477 new confirmed cases. There were 45 new confirmed reported deaths. In the city of Boston, as of Monday, 316 new confirmed cases, bringing our total of cases of coronavirus in Boston to 51,506. There were 5 new deaths reported yesterday, bringing our total in Boston to 1,133. My heart goes out to everyone who lost a loved one during this difficult time, and also those that are still sick and suffering in hospitals with COVID right now or at home. We want you to know you're in our thoughts and prayers. Data for the week ending January 17th, we had an average of 5,351 people were tested each day. That's down slightly a little bit from the week before, and again, that does not include college testing. The average number of positive tests each day was 416. That's down compared to the week before as well. Our current community positive rate was 7.2%. It's also down from the previous week of 7.5%. We've seen positive test rates go down in every neighborhood, which is a good sign, and we're encouraged by seeing these numbers go down a bit. Still high, too high for where we want to be right now, but the numbers are definitely, I guess I wouldn't call it a trend, going in the right direction a bit here. East Boston, Dorchester, Hyde Park, and Mattapan still have the highest positivity rates in the city. Again, I want to thank everyone who continues to do their part by protecting themselves, their families, and our city. While there's been some improvement in recent weeks, it's still vital that everyone remains vigilant in combating the coronavirus. We're asking people to continue to wear your masks when you're out in the public or when you're in gatherings. We want you to avoid large gatherings. We want you to wash your hands with soap and warm water and continue to disinfect frequently touched surfaces as much as possible. Think about the simple steps that we can take on a daily basis to protect yourself and your loved ones. And a lot of us are in the routine now of doing this, but we just need to stay vigilant on that. As we continue to reach out and check on people, we're asking you to check on people who might be experiencing isolation or struggling, just to check in on them, a phone call, or if you see them in the street, just a quick conversation, knock on the door, say hello to them, but obviously do it physical and do it with distance. We want to let people know, and the people that are watching today, you're not alone. There is a light at the end of the tunnel. We will continue as a city and as a state and as a country to make it through this. We're asking people just to stay focused on a day at a time, and that's been able to help a lot of people, including myself, get through the virus a day at a time. It seems like it's been going on forever, and it has been going on we're about 11 months in now, and we just need to continue to stay vigilant on all of this. I want to thank everyone for doing your part day in and day out, and thank you for continuing to do your part. I'm going to remind everyone to get tested as often as possible. It's quick and easy. We have over 30 sites throughout the city of Boston. We also have mobile sites that are free and open to all, regardless of symptoms. And I'll give an update of where those sites are right now. One is in Dorchester at Prince Hall Grand Lodge in Grove Hall. This is a walk-up site and on-site registration, so you can just walk up, register on-site, and get tested. In Hyde Park, the Boston Renaissance Charter School, this is a drive-through, and you must book an appointment through the online scheduler. So if you want to get tested, it's quick, it's fast, it's easy. You drive in, you stay in the car, you put the windows down, and they test you. In Roxbury at Washington Park Mall, pre-registration is also required there, so you'd have to register, and I'll give you that information in a second. And in Jamaica Plain at the Mildred Haley Apartments, this is a walk-up site, on-site registration, so you can just go to the site, drive to the site, or take the train or bus and get out, and you can walk up and get registered and get tested immediately. There might be a little bit of a wait there. It's not too long of a wait, but it does move quickly. Dates and times for all of these sites vary, so you can visit boston.gov to get all of the sites in the city of Boston, including the 4 I mentioned just now, or call 311 for a complete list of details and from information. We're also proud to announce that the Strand Theater in Uppins Corner in Dorchester is now operating as a test site. This is a partnership between the City of Boston, the Strand Theater, Brookside Community Health Center, Brigham Women's Hospital, Southern Jamaica Plain Health Center, and Uplands Corner Community Health Center. So what we're doing is creating another site to be able to get tested. Testing started at the Strand yesterday. It will be operating on Mondays and Wednesdays between 8:30 a.m. to 4 p.m. The Strand is certainly a beloved cultural institution that the city and the community have worked hard to revive in recent years. I'm proud of the way that we're using this space to meet the needs of the community during difficult times. Again, for more information on the Strand Theater testing, you go to boston.gov, or you can simply call 311. The city is supporting the state's vaccine rollout. We're working very closely with the state to expand the number and the types of vaccination sites to make it more equitable. Yesterday, the state announced a new mass vaccination site will open at the Reggie Lewis Track Center in Roxbury next week. This is in partnership between the state and the City of Boston. This is in addition to the site at Fenway. The City of Boston, the Boston Public Health Commission, will continue to monitor the data and help the state direct resources where they need it the most. This includes smaller priority group clinics, neighborhood sites, and mobile teams. For more information, including a full schedule of vaccine rollouts, is available on the state's website at mass.gov/COVID-vaccine. That's mass.gov/COVID-vaccine. We know that there are lots of questions about the vaccine, and people have lots of questions. We're committed to making this information clear and accessible as possible to everyone. Last week, the Boston Public Health Commission held a virtual COVID-19 vaccine information session. We will share a recording of the session online. This Thursday, we're holding the same live session in Spanish. We're asking people to tune in to bphc.org. We're making it clear to everyone that the vaccine is safe, it's free, and it's one of the best ways to protect yourself and your loved ones. We understand that some people are hesitant to get the vaccine. This is especially true in the Black and Latino community. We're talking to residents about their concerns and making sure that everyone has all the facts about vaccinations. COVID-19 has hit communities of color the hardest here in the city of Boston. We don't want communities of color to miss out on the vaccine because it's the best tool we have to put this pandemic behind us and begin to heal as a city. The City of Boston will continue to empower local residents to share information in their communities and in their languages. Again, I urge everyone to take the vaccine when your time comes. And I want to thank the folks that who have been able to get the vaccine for taking the vaccine. Today, I also have an update on the City of Boston's reopening plans. In mid-December, I announced that Boston would temporarily pause our reopening and move back to a modified phase two, step two program. We anticipate an increase in cases around the holidays, so we took action to try and slow the spread of the virus, to protect hospital capacity, and to avoid a more severe shutdown later on. The pause was set to expire tomorrow, January 27th. We're extending this pause through the end of this month. So on Monday, February 1st, we will move forward into Phase 3, Step 1. At that point, all businesses and activities that are allowed to operate in Phase 3, Step 1 can reopen with the capacity limits in place. The list includes indoor fitness centers and health clubs, including gyms using alternative spaces, movie theaters, aquarium, museums, indoor recreational and athletic facilities, indoor recreational venues and with the potential for low contact use like batting cages, driving ranges, bowling alleys, and rock climbing. Sightseeing and other organized tours, including bus tours, duck tours, harbor cruises, and whale watches. Indoor historical spaces and sites. Indoor event spaces, indoor and outdoor gaming arcades. Most businesses will be subject to the 25% capacity limits that the state extended through February 8th. All gatherings and events remain subject to capacity limit of 10 indoors and 25 people outdoors. This applies to public and private spaces. For a list of sectors subject to the extended capacity restrictions, we're asking you to visit mass.gov/reopening. Throughout the pandemic, Boston and our public health department have taken a cautious approach. We will only move forward with reopening if the public health experts feel that it's safe to do so. So everybody has a role to play in making sure we can bring back more activity safely. Again, wearing masks, social distancing, washing hands, We're asking businesses to enforce all safety protocol and let your employees work from home whenever possible. If it does not, if everyone does their part, we'll be able to move forward with reopening faster. I just want to close today by sharing the beautiful words of the inaugural poet, Amanda Gorman. Ms. Gorman has ties to Boston. She spoke at the City of Boston's Immigrant Heritage Month celebration this past July. During a difficult time for our city, she helped to highlight how resilient we can be as a city. And she echoed those values in Washington, D.C. last week. She said, "The new dawn blooms as we free it, for there is always light, if only we're brave enough to see it, if only we're brave enough to be it." I want to thank you once again and the people of Boston for your resilience and your kindness. We will get through these hard times stronger than before. And now I'd like to hand it off to Chief Marty Martinez, who will give an update and then take questions.
Thank you, Mayor. Just briefly, wanted to just share a little bit more information on the vaccine before we open up for questions. You know, as the state continues to manage the vaccination program statewide, including deciding where doses go and when folks are prioritized, the city will continue to make sure that Boston gets its needs met, especially in our hardest hit communities. This has been how we've approached COVID response this entire time, and vaccine distribution will be no different. As reported, we're taking the lead with the state to support lifting up the Reggie Lewis Center this next week, and we'll scale up. It will start next week and then scale up over the next several weeks. We identified the site and are working to lift it up with our hospital partners, and we're glad to work with the state to create this site in Roxbury. In addition, we've been working closely with a few key hospital partners on priority group clinics that have been operating over the last several weeks here in Boston to vaccinate our first responders, COVID-facing healthcare workers that are not COVID-facing, and starting this week, our school nurses working in Boston are getting vaccinated. We've worked to create local access as needed, and will continue to do that in partnership with the state to ensure that we can meet people where they're at. Local access is key, and we've continued to prioritize that along the way. Over the next few weeks, we'll be finalizing additional sites in partnership with health centers, hospital partners, and other clinical partners to ensure that there are sites across the city as more people become eligible to be vaccinated and more doses become available to be used. Of course, all of this is dependent on distribution of doses by the state and then available locally. With residents 75 and older eligible starting next week, we will see more dedicated sites from hospital centers and health centers for their patients in various neighborhoods across the city starting next week. And we'll provide some additional information later this week about some of those sites. It's important to note that this complex system rolled out by the feds and managed by the state needs the city to be a local partner that puts Boston first and ensures equitable delivery across our neighborhoods. That's exactly what we've done this entire 11 months around our COVID response, and we will continue to do that in distributing the vaccine. So with that, if you have any COVID-specific questions, I'm glad to take them. Yes?
Is the same amount of vaccines going to be at each of these locations, vaccination sites around the city? Like, how are you going to actually distribute that to these local sites?
Yeah, so the question is will there be the same amount of vaccines located at these sites, and how are we going to distribute them? To be really clear and to clarify, that's the state's role. The state distributes vaccines to providers to vaccinate individuals, and they set the prioritization. The role that the city has is to try to create local sites to be able to serve as those access points. So we don't have doses. We're not distributing doses to providers. What we'll be doing is creating, in partnership with health centers, which we're already doing, in partnership with health centers and hospitals, places in the city where people can get vaccinated. So as I said, I think we've had roughly 2,600 first responders vaccinated, and all of those first responders, for the most part, have been vaccinated in the city of Boston in partnership with different health clinics that we've set up. So as we lift up additional sites in partnership with the state, we'll be relying on them to help us make sure there's doses available. But again, it's important to note they're relying on the federal government to make sure there's enough doses distributed to Massachusetts. Yes?
Do you think there was enough locations in the city in communities of color out of the gate, even helping with the first responders to try to get the vaccine?
Yeah, the question is, do we think there was enough locations already set up in communities of color? It's important to note that what we don't want to do is set up locations where there's no doses, where there's not people eligible, and that's been clear around the state. You know, you've seen across the country where sites have been set up all over, but not enough doses, people waiting for appointments, no clarity around who's eligible. So that's not how the state's doing it here, and Boston obviously is following that lead. So we've been committed, like we did around testing, making sure that there will be access in communities of color when there's a large number of folks that are eligible. So again, we've been able to make sure that, you know, fire, police, EMS have been able to get vaccinated, healthcare workers through hospitals and health centers, again, school nurses starting, and then starting next week, you'll see 75-year-old residents of Boston be able to get vaccinated in different neighborhoods across the city, especially those in neighborhoods that are hardest hit in the community.
Just one follow-up. The 75 and older, how do you connect with them? A lot of them have trouble navigating it.
Yeah, great question. So, you know, the state changed the prioritization just yesterday to make sure that 75 and older would be eligible starting next week. And so we've been working already with hospitals and health centers to make sure that their mechanism of notifying their patients, some will be done through calls, some through letters, some through direct outreach. We will make sure that that information is updated on the state website. We know coming Monday, Fenway Park and Roxbury Community College will be accessible for folks to make appointments. That will start this week, but we'll also be working with our Age Strong Commission here in the city to help make sure they have the information to push out into the community. We want to make sure folks know what's accessible, but we also want to be clear there's not enough doses to vaccinate everybody on Monday. So it will take some time to ensure that the supply is going to meet the demand, but it's going to be an all-hands-on effort, which we're continuing to partner with the state on. Yeah.
Last week, one of the first executive orders that the new president put in involved, I think it involves sort of federally set up local sites. Is that something that's happening around here, or am I misunderstanding that, or what?
Yeah, the question is last week one of the executive orders from the Biden administration talked about federal sites being set up through FEMA. That would be in collaboration with the state, and the city hasn't been notified of any specifics to do that in the city of Boston. Any additional questions?
Talk a little bit more about the nuts and bolts about what goes into the decision to move ahead to phase 3.
Yeah, so a little bit more about the decision to go back into reopening. You know, starting February 1st, as the mayor mentioned, we will reopen sectors back to phase 3 of reopening. You know, we've seen a little bit of improvement in our cases. We've seen some improvement in our positivity. We've seen a decrease in hospitalizations. The state has seen that across the Commonwealth, and we are seeing it in the city of Boston. And so it was a decision to sort of get to a place where we can start to reopen again, right? We're reopening, you know, in increments as we start to get students back in person also in February 1st. We'll also see, with capacity limits that the set has stated, some reopening. All along the way, the mayor has prioritized what has the data said. How do we look at the data? How do we look at the science? And the data and science here tell us that we're starting to see improvement. We've had, I think, 3 straight reports. We have another one coming out in the morning that likely will show that we've seen 2 full weeks of data improving and decreasing cases, which means that we can start to reopen somewhat. But it's really important that everyone continue the vigilance, wearing a face covering, socially distancing, not being with folks outside of your household. We need everyone to keep it up, but we also know that we're starting to see a little bit of light, so we want to make sure to reopen those things.
Why do you think the numbers are going down? Because people are now detached from the holidays, not
Yeah, I mean, why do we think the numbers are going down was the question, and part of that is definitely the case. We knew we'd see increased cases into the holidays. We knew we'd see that for a duration of time, and we've started to see that level off, right? And that was somewhat both the expectation, but also a little bit of hope that we would see the numbers decrease. Testing has stayed constant, so we're catching cases and we're making sure that we can contain it. So we have seen some of that, which is a really important thing to see. I think even in hospitalizations, we have almost 80 less patients on average this week than we had even 2 weeks ago. So we're definitely seeing a decrease, which shows us that you know, we're continuing to make some progress in this fight.
You're a little far removed from the holidays now. The surge that you saw after the holidays, is it what you expected pre-holidays?
Yeah, so the question is, we're a little bit removed from the holidays. I mean, after the holidays, you expect anywhere between 2 to 3 weeks to start to see some of that. So we did see an uptick in cases. We saw a big increase right after the holidays. We didn't see that translate into really high numbers into our hospital. So we're grateful that it wasn't a surge on top of a surge. But the hospitals are still, there's still a lot of folks that are battling COVID, and our hospitals are working through the capacity limits. But again, we're grateful that we didn't see the surge on the surge. We're not out of this by no means, and I don't want to send that message, but with a little bit of progress, we're hopeful that we're going to keep seeing it. Thank you, everybody.